The posterior approach can be used as an alternative to anterior nerve blocks. The puncture can be made with the patient seated or in a lateral recumbent position. We prefer to have the patient lying down with his head placed axially on a pillow. The cervical and thoracic spine is flexed. The spinous processes of the 6th and 7th cervical vertebra are well palpable. Both processes are marked. The puncture site is 3 centimeters paramedian to the interspinal line between the two processes.
Achtung, kleiner Pieks, ja?
When using this approach, you must ensure deep infiltration of the puncture channel.
Geht? Alles okay? First the dummy should success, gell? Alles gut?
The puncture is made in the sagittal plane perpendicular to the skin 5 to 10 degrees to the lateral. Therefore, when the head is pendant, the puncture is directed caudad, aimed approximately at the height of the cricoid. Any deviation from the sagittal plane towards the midline must be strictly avoided. At a depth of 4 to 7 centimeters, the transverse process of the 7th cervical vertebra is sought. After a slight adjustment of the puncture direction cranially, above the transverse process, the stimulation needle is advanced 1 to 2 centimeters until parts of the upper trunk or the lateral cord are reached. This triggers contractions in the musculature of the shoulder and or the upper arm.
Alles okay?
The stimulation current is reduced and 40 to 50 milliliters of local anesthetic can be injected after performing a negative aspiration test. In this patient, we are placing a catheter for post-operative analgesia and to aid mobilization.
Braucht dann aber 2 Hände dazu. Ja. 2 Seiten mit der linken. Wenn das wehtut, sagst du es. Alles gut, es passiert nichts mehr.